A very good day to my dear lecturer and then my dear friends. Today, my group members and I are going to present about diabetes. So before that, let me introduce myself and my group members as well as my name is Tanusha Jairaman. My other group members' name is Kabirtana, Koyum, Hazrul and Saranya. Now, I would like to present my part which is Introduction about Diabetes. Diabetes is a disease that affects your body's ability to produce or use insulin. Insulin is a hormone. When your body turns to food you eat into energy, it's called sugar or glucose. Insulin is released to help transport this energy to the cells. Insulin acts as a key. It's a chemical message tells the cell to open and receive glucose. If you produce little or no insulin or are insulin resistant, too much sugar remains in your blood. Blood glucose levels are higher than normal for individuals with diabetes. There are two main types of diabetes. When you're affected with type 1 diabetes, your pancreas does not produce insulin. Type 1 diabetes, once called juvenile diabetes, is often diagnosed in children or teens. However, it can also occur in adults. This type accounts for 5 to 10% of people with diabetes. Type 2 diabetes occurs when the body does not produce enough insulin or when the cells are unable to use insulin properly, which is called insulin resistance. Type 2 diabetes is commonly called adult onset diabetes, since it is diagnosed later life, generally after the age of 45. It accounts for 90 to 95% of people with diabetes. In recent years, type 2 diabetes has been diagnosed in younger people, including children, more frequently than in the past. There are other forms of diabetes, which is gestational diabetes. Gestational diabetes occurs during pregnancy and affects about 18% of all pregnancies, according to the American Diabetes Association. Gestational diabetes usually goes away after pregnancy, but once you have had gestational diabetes, your chance to higher that it will happen in future pregnancies. In some women, pregnancy uncovers type 1 or type 2 diabetes, and this will need to continue diabetes treatment after pregnancy. There seems to be a link between tendency to have gestational diabetes and type 2 diabetes, and many women who had gestational diabetes develop type 2 diabetes later on. Gestational diabetes and type 2 diabetes both involve insulin resistance. Certain basic lifestyle changes may help to prevent diabetes after gestational diabetes. Another form is pre-diabetes. This condition causes a person's blood sugar levels to be higher than normal but not high enough to be diagnosed with diabetes. The American Diabetes Association estimates that there are 84.1 million Americans that have pre-diabetes in addition to the 30.3 million with diabetes. Thank you. That's all from me.
Hi, Assalamualaikum warahmatullahi wabarakatuh. And my name is Muhammad Qalbin Abdullah, and my number matric is H21A2895. Alright, now we're gonna look at the structures of body system that's involved. Alright, in the human anatomical system, there are various organs in the human body that are constantly working to ensure that the body working system is stable and can function properly. Each organ has its own function, and if one does not function properly, it will interfere with the rest of the other organs because most organs will depend on each other. In addition, for example, the organs that we know are such as nervous system, brain, skull, lungs, stomach, pancreas, heart, kidneys, nucleus, and so on. And in the matter of diabetes is disease that most people face regardless of age. Diabetes that can be avoided by various age group, but it is usually faced by the age group of 18 years and above, according to daily newspaper quotes. This diabetes will target human internal organs, which can lead to chronic disease. Example organs that are damaged by diabetes are the brains, eyes, teeth, nervous system, kidneys, and heart. The following explanation of the function of the organs. The first one, we're gonna take a look at brains. The brain's vital and complex organ that is central in the human body and is also the center of command for the whole body, and brains organ are protected by the skull, meninges, or also called meningitis. The brain systems will give a signal to an individual if there is abnormality in the body system, and also receive an impulse from the cells found throughout the body to be delivered by the nervous systems and to the brains. Okay, number 2 is lungs. Lungs is one of the respiratory organs, are very important to humans because the lungs carry oxygen to the brain and to the rest of the body and release carbon dioxide into the air. With the help of the process of pull and push by the lung, assisted by the diaphragm, and the incoming oxygen will pass through the trachea located in the human body cavity to allow other organs to function in good condition, as well as oxygen will be carried by hemoglobin in the bloodstream system. The lungs have a pair of every human and have a million of alveoli that will help process oxygenated air into the blood. Okay, number 3 is heart. The heart has many blood vessels that will carry oxygen in the blood and carry it throughout the body. And the heart also has 2 parts, where the right side will carry deoxygenated blood to the lungs, and the left side of the heart will carry oxygen to the rest of the body. Right, number 4, kidneys. Kidneys is a system of filtering toxic substances and remove waste, extra fluids, and acid from a person's body. Next, platelets are located below the ribs and next to the spine in left and right position in the body. Furthermore, the kidneys are a part of renal system, including also ureters, bladders, healthy balance of water, salt, minerals into the blood. In addition, the kidneys can also produce hormones in humans, such as vitamin D and erythropoietin. Right, number 5 is a pancreas. The pancreas is a glandular organ in the human body. Plants, they are less known functions and they are present in the body. This gland is an important organ in the digestive systems and play a role in controlling blood sugar so that the body does not lack sugar, and also provide energy to humans. And number 6, sexual. This organ is a very important organ for human life because it plays an important role for human reproduction. This organ is our organ in the reproductive system. Furthermore, the genitals also divide into 2, namely men and women. The male genitalia are known as the testes and the female genitalia are known as the vagina. Right, we're going to mouth and teeth. The mouth is one of the organs in digestive systems and not only serves to digest foods, but also serves to carry out air into the lung. The mouth also has the function of communicating between other human beings, and the teeth are also associated with the mouth as it is also one of the organs in digestive systems. The function is for chewing food, biting, and so on. The last one is skins. Skins, in fact, the largest organs in the human organ. The skin has multiple functions, and the anatomical structure is also a bit complex. And skin also has important parts such as epidermis, dermis, hypodermis, which have a function to protect from various dangers, for example, UV radiation, disease, and others. Skin also serves to give color to human skins. Alright, that's it for me. We're gonna go to the next slide. Thank you. Assalamualaikum and hi everyone. My name is Muhammad Azul Fazrin. Today I want to talk about factor associated with the diabetes. Factor associated with diabetes are five factors. First, lifestyle. Second, gestational diabetes and pre-diabetes. Third, family history. Fourth, FAH. And fifth, insulin resistance. And now we go first. Factor is a lifestyle. Lifestyle is individual who like to eat a food, men and drinking a lot of soft drinks and also easy to get diabetes because in the content of food and drinks have a very high sugar content. Second, gestational diabetes and pre-diabetes. Gestational diabetes is a condition in which a woman's blood sugar level rises during pregnancy, not because she has had diabetes. Third, family history. Based on previous studies, type 2 diabetes is one of the diseases that can occur due to family genetic factor. And fourth, factor H. Among the factors that cause diabetes is the H factor because the production of insulin in the body increase with the increased age. And the last, insulin resistance. There are several that can cause insulin resistance such as genetic factor, aging factor, and leverage. That is to me. Thank you.
Diabetes management is to improve the quality of life and productivity of diabetes. Diabetes management can be divided into two categories. The first is a non-drug method that involves proper diet and physical exercise, and the second is the use of drugs of regulate blood sugar and insulin levels such as diabetes medication. Diabetes affects every part of our body. To manage diabetes properly, we must take action to keep our risk factors in check and within normal ranges, such as eating a balanced diet. A nutritious diet can help people maintain and improve their overall health. It is critical to hit the right nutrients on a daily basis. When dieting, nutrients can be found in a wide variety of meals and diet regimens. People who have a diabetes must keep track of their food intake to maintain a healthy diet. A bad diet can increase chance of developing chronic disease like hypertension, obesity, and especially diabetes. Our bodies require food for a multitude of reasons. If someone has diabetes, they should consume more fruits, vegetables, and all grain foods that are high in nutrients and fibers but low in fat and calories, and avoid animal products and processed carbs and sweets. Another approach to manage diabetes is to engage in physical activity. Physical activity is defined as any physiological movement involving skeletal muscles that result in energy expenditure. It includes everything from daily walking or cycling to get from point A to point B, to active play, work-related activities, active recreation such as working out in a gym, dancing, gardening, or playing active games to organized and competitive sports. Exercise is a planned, structured, and execute physical activity with the purpose of improving or maintaining physical fitness as a final or intermediate goal. Even person with diabetes, according to this, required varied aerobic activity. Sugar is transported into cells and transformed to energy during exercise, which is lower blood sugar level. Lastly, diabetes can manage by using drugs. Diabetes is managed with medications such as oral blood sugar lowering pills or insulin injections. Oral pills are used when a person's blood sugar control cannot be achieved through a combination or dietary adjustments and physical activity. Oral pills or insulin injections may be given at the time of diabetes diagnosis if blood sugar levels are dangerously.
A very good morning to the madam and my fellow friends. My name is Kabirtana Anaprum K. Virya. My metric number is H2182109. Today, my portion in this group assignment is recommends of business potential for the diabetes disease. Okay, firstly, I would like to start with why we choose IGLS plate. IGLS plate is a plate that can show us how much sugar that contains in our food. So, if we cut sugar in our food, so it will help us to reduce the diabetes. Okay, firstly, I will start with how IGLS plate are made of. IGLS plate are made with silver plate. From silver plate, it's an item made of a base metal like a copper, brasses